Hello and welcome, it's Chris from Christopher Holt Training, and welcome to this week's tutorial where we're going to be asking the question, what should I avoid if I have lumbar herniated discs? Now, this was a question that I was asked through my YouTube channel, so periodically I put up a question asking about what people want to learn, what people want to hear about, any questions that they might have, and this was one of them. So what we're going to do is we're going to answer that, but what we're going to try and do is we're going to build into that answer. So first of all, we're going to ask, what is a herniated disc? Then we're going to look at what causes a lumbar herniated disc, because a lot of how we solve that problem lies in how it's created. Then we're going to look at, do McKenzie exercises work? I get asked this regularly, and there's a few nuances that people need to understand with regards to McKenzie exercises, because it's not necessarily a one-size-fits-all type solution. We've got to understand some of the specifics about back injuries, and then we can understand these McKenzie exercises a lot better. And then we're going to talk about what should I start doing. So what can we start putting into place in order to overcome the pain that we experience from lumbar herniated discs, or we can think about what we need to do in able to prevent it happening in the future, or at least reduce risk of it happening in the future. Before that, however, I just want to quickly mention my social media, which you can just see on the screen there in the top right hand corner. Please do come to any of those platforms, like, follow and subscribe. If you're on YouTube, please click the subscribe button and click the bell. It'd be great to have you there, and you'll be notified whenever I release my next tutorial or workshop. Alternatively, you can follow the URL. It's at the bottom of the screen, but it will be in the description below. And that goes through to my lower back pain and spine health free webinar. On there, you'll be able to learn more about how to overcome lower back pain, how to maintain a healthy spine, and you'll also get the opportunity to get involved in my 12-week online training lower back pain exercise and stretch program. So if you want to come along there, it'd be great to have you there. You just click that link, sign up to the next one, and I will speak to you on that next webinar. So back to this week's tutorial, where we're looking at what should I avoid if I have lumbar herniated discs. So first of all, what is a disc herniation? Well, as you can see from the screen there, you've got on the left-hand side a normal disc, and on the right-hand side you've got a herniated disc. Now, there are essentially two components to the disc. You've got the light colour in the middle, which is a gel-like fluid or a jelly-like fluid, and then the slightly darker pink, you've got a fibrous wall. Now, it's not one sort of, let's just say, one fibrous wall. There are many rings to it. So if you look at a tree stump and you see the rings on that tree stump, that's kind of like the anatomy of that fibrous wall around the outside. So a disc begins to herniate when its jelly-like nucleus pushes against its outer ring due to wear and tear. So a herniated disc is essentially this gel moving from the inside to the outside of your vertebrae, and then when it touches on that nerve and creates that pain, that's when you know, or when you understand, that you might have a herniated disc. Now, when we talk about the cause of it, I need to bring your eyes to the last three words of that short little description there, and it's wear and tear. Herniated discs are not normally a one incident or one movement type injury. It happens over a long period of time. So when we talk about what causes a herniated disc, we got to start looking around, not just at that one event when it triggered the pain, but we've got to look at everyday life, how you're going about your day, how you're going about your week, month and year. Because Adams and Hutton found that axial compression and flexion loading caused disc herniations in 43% of specimens and vertebral fractures in 57%. So what they're essentially saying is when the spine is compressed down and flexed, that's when it's most likely, or that loading pattern is most likely going to cause disc herniation. So we're looking at things like you can see on the screen there: poor sitting posture, poor lifting posture, poor exercise technique, and I've got an exercise there, the sit-up and the crunch, or the sit-up or the crunch, because that sit-up there is putting the spine into full flexion, which again is increasing your risk of a lumbar herniated disc. Secondly, as I mentioned before, disc herniations are often injuries, but few are traumatic. And prior tissue weakening will often contribute to the herniation. So again, you can see in the third line there, they say prior wear and tear. So it's all the small movements, all the incorrect movements, all the incorrect postures that are adding up to create your lower back pain. So again, it's not just that one movement, it's not just that one moment that triggers your pain. It's a small build-up of a lot of little things that you've been doing wrong that then eventually turn into that injury. So that's how we have to think about lumbar herniated discs. So hopefully that now gives you a better idea of how or what a lumbar herniated disc is and how it's created. Because again, it's not that one moment, it's a build-up of many moments that are turning into a lumbar herniated disc. Question 3 was, do McKenzie exercises work? Now, first of all, we have to understand a little bit more about lower back pain. We have to understand a little bit more about disc herniations, and we have to learn a little bit more about how these exercises can affect lumbar herniated discs. Now, we've got a few different exercises here, which I'm just going to highlight. We've got one, which is where you're just led on the floor, which is that one exercise there. Then we've got 3 extension exercises. So we're putting the spine into extension. So that's those 3 here. And then the final group are 3 flexion exercises. So if we go back to exercise number 1, which is the lying exercise. Now, this exercise can be useful for lower back pain, for lumbar herniated discs, for the very reason that you can use gravity. So what you'll find is, if you remember back to the disc, so if I just quickly draw, you've got your jelly-like fluid, you've then got your fibrous wall, you've got your vertebrae here, so that's the little spinous processes that stick out the side. Now what you generally find is that the fluid comes out from the middle out to the back. So this would be the front of the disc, and this would be the back. So if we are lying up, the back of the disc is up here. So you can use gravity just to allow that fluid to sink back into the disc. So if you find that lying on your front eases the symptoms of pain, then this McKenzie exercise can have its uses, because all you're simply doing is just using gravity to allow that fluid to sink back into the disc, so it's not irritating on the nerve out here, if you follow. So it's very much, that is just in a sense countering what's been created in regards to a herniated disc. So the fluid has moved from the middle to the back. If we lie on our front, we can use gravity to allow that to sink back into the middle, if that makes sense. Now, with regards to extension exercises, if you have any facet joint pathology or conditions, then these exercises might not be for you, because on the back of each of your vertebrae you have a joint which allows each vertebrae to move on top of each other. Now, if there is an issue with that joint, these exercises aren't going to be effective, because what you're essentially doing is you're squashing those joints together. So the idea of the exercise is to, again, sort of counteract and mechanically reverse the symptoms that have been created here. So that, as I've mentioned, the fluid goes from the inside to the outside, and the thought process is that if we move then the spine in the opposite direction, then it should go back into the middle. That's kind of the very sort of basic idea of these exercises. But if we have facet joint injuries or some sort of joint with some sort of pathology or injury or issue with spinous processes and the facet joints, then we're going to experience pain with these exercises. So the determining factor between these two types of exercises is, does it trigger pain? Do you know if you have an extension-based problem with your back? Lumbar herniated discs are generally a flexion-based problem, but you may have extension-based symptoms as well. That all depends on if you've had a proper assessment on your back. If we then come to the third exercises, these are all spine flexion postures. Now, again, partly to do with people's backs can become very tight. So what generally is thought that if we then lengthen those muscles, we are going to then stretch out those muscles. But these types of positions and postures, one, they are encouraging this mechanism, if you will. So it's encouraging the jelly-like fluid to move from the inside to the outside. So that's sort of one part to it. But also, if we are stretching the muscles of the lower back, so if we are lengthening those muscles, what it can create is more sensitivity within those muscles to pain. So if we are flexing the spine and trying to stretch those muscles, we can increase their sensitivity, and therefore we can, in a sense, increase our susceptibility to pain in the lower back. So we have to be very careful with these types of exercises. From my perspective, I would just say avoid them, because there's a lot of other things you can be doing in so much as building the health of your spine and building the health of your lower back. I would say the same for this one. I would avoid these. Again, there's a lot of other things you can be doing. This one, however, can have its uses because it's a very simple way of just allowing the gel-like fluid to sort of recede back into the disc. So what we'll talk about next is some of the solutions that you can put in place in order to start overcoming the pain or the condition that you may have that is lumbar herniated discs. Finally, what should I start doing? Well, we've talked about the McKenzie exercises and their effectiveness. There is the option of using the lying on your front, but with all of these suggestions, you have to run it through a sort of a questioning feedback filter. So first of all, you have to ask, is it making it worse? Is it making it better? Then you have to go and think about how you're performing the posture, the position, the exercise, the stretch that we're talking about, because we have to get these techniques right. Because again, what we want to try and reduce is the triggering of the pain. So when pain is being triggered, that's something to avoid. When pain isn't being triggered and it feels good and it's relieving the symptoms, then we have to start, in a sense, doing more of them. And what we can start doing with regards to the journey that we're on is we can start moving apart in time, that is, the pain triggers. So if you're getting pain triggers every single day, can we get it to every other day? Can we then get it to every third day? Can we get it to once a week? Can we get it to once every 2 weeks? Can we get it to once a month? Whenever I'm working with people, that's what we're trying to do, because there's never a one-size-fits-all, we've got lower back pain and then all of a sudden we've not got lower back pain ever again. It's very much a journey that we're on. We're thinking, okay, how often do I experience it? Well, I experience it every single day. Well, then we've got to start finding strategies and ways that we can start moving that to once every other day, a couple of times a week, once every 2 weeks, 2 times every 2 weeks, whatever it might be, once a month, and then expanding that out till we start reducing the moments that we experience lower back pain. And what we're essentially doing is we're building our competency with regards to how healthy our spine is. And in a sense, anyone with lower back pain, we are on that journey. I've been on that journey since I was 14 years old. I'm now at a point where I very rarely experience lower back pain. I get a few twinges and sort of moments where I can feel it coming, but then I know exactly what I need to do before a full-blown episode of lower back pain happens. So that's the journey that we're all on. So to answer that question, what should I start doing? Well, if we look at picture number 1 here, this is all about moving well. Now, I'm using this lifting posture and this hip hinge as the example because this is the most common posture to be in where people can aggravate their back pain. So what we've got to start thinking about is when we go into this lifting posture is this sort of natural curve of the lower spine. Now, I'm exaggerating it so you can see it. So we've got to try and maintain that natural curve through the spine as we go and lift something from the floor. Now, that means hinging at the hips. So we're using that hip joint there to hinge and maintaining the posture through the spine. Now, if we don't have the range of movement here, we've got 2 choices. We can either round the back, which is probably the least effective, or we can bend the knees slightly. So what we want to be thinking about is whatever posture you go into, be it exactly the same as this, lifting a box off the floor, or any posture which means having to hip hinge or flex at the hip as I'm doing here, we need to maintain this posture. Because if we go back to the disc, we've got the front here and we've got the back here. Every time we round our back, we are pushing that jelly-like fluid towards the back. When we keep it in this neutral posture, it's then being spread equally all the way around. So it's not being pushed in any one direction more than the other. It's being evenly distributed around, hence it then has the greatest chance of staying in the middle as a healthy disc. When it comes to stretches, we come to image number 2. Now, this is just one stretch. There are many stretches that you can start doing, but one area to begin stretching are the hips. Don't stretch the upper back because, as I've mentioned, that can make your lower back and the muscles of your lower back more sensitive to pain. If you can stretch the hips, you can gain more range of movement at the hips, which is going to help your lifting, which is going to help your spine health. You're also going to relax the muscles around it, the lower back that is, and also, as I've mentioned many times, I describe the hips as like a pressure cooker for the lower back. So as pressure builds up in tight hips, the pain can come out of the lower back. So we need to start stretching the hips. So that means the adductors on the inside, as I'm doing here, the hip flexors on the front, and the glute muscles sort of on the back and on the side of the hip here. And then finally, number 3 is exercises. Now again, whenever we're doing exercises, same as movement, we want to be able to maintain the proper posture of the spine because we want to be distributing the pressure on the vertebrae evenly all the way around by maintaining that position. Now this specific exercise is called the bird dog. Now this reduces pressure on the spine, or compression on the spine I should say, and also keeps the muscles of the spine active, so they're able to protect the spine without overdosing on compression. And we can then go into planks, side planks, and we can build up the abdominal wall and the obliques of the side. And then finally, we would just use lifting exercises, but again, maintaining proper posture, and also glute activation exercises to make sure we're getting the muscles of the hips nice and active. Because the muscles of the hips and the abdominal muscles, they're the ones that are going to also relieve pressure on the muscles of the lower back. Because if glutes and abdominal wall aren't working correctly, something's got to pick up the slack, and generally it's the erector spinae muscles and the muscles around the spine. So those are my sort of answers that build towards what should I do to avoid if I have lumbar herniated discs. It's all about reducing pressure on the lower back and maintaining good spine health, which means good movement, which requires good flexible hips and also good active muscles as well. So hopefully that's been helpful. Hopefully it's given you a better insight into how to manage your lower back pain or manage your lumbar herniated discs. And again, as I've mentioned, please do come along to the webinar. You'll learn more about this. Come along to social media. Again, I'm posting more about this topic. And it will be great to have you on board. So my name is Chris from Christopher Holt Training. I look forward to speaking to you in the next tutorial.